this is Starla. Just wanted to talk to you today about another unmentionable, vaginal discharge. This is probably the most common topic I talk to women about almost every day. What's most important to know is that vaginal discharge is almost always not a bad thing. And I think if the word discharge wasn't always associated with an infection, then we would think about vaginal discharge differently. All women have vaginal discharge, and it's there for a reason. We have discharge to keep the vaginal tissue moist. It's a very delicate tissue, and just like the tissues in your mouth, it has to stay moist to be healthy. The vaginal discharge keeps the perfect balance of the normal flora found inside the vagina. Flora is the bacteria and microbes that are on us and in us all the time. They're on our skin, they're in our mouths, they're in our gastrointestinal tract, and yes, they're even in our vagina. For women, normal vaginal discharge changes throughout the month due to our hormones, estrogen and progesterone. They can be subtle changes for some women, and they can be very distinct for other women. During the menstrual period, of course, we have bloody vaginal discharge, and this lasts anywhere from 3 to 5 to 7 days, and this is due to the lining inside the uterus sloughing off, which it does every month. Then, the discharge seems to disappear for about 3 to 5 days after the menstrual period stops. Some women don't notice any discharge at all. But when a woman gets ready to ovulate, when an egg is released from the ovary, she will begin to have a very mucousy, clear, stretchy type of discharge for about 3 to 5 days. This discharge helps the little spermies swim up into the uterus and fertilize the egg. Once she ovulates, the discharge will change to a thicker, whitish type of mucus, and this is what she'll have until her period starts again, and the whole cycle starts over again for the next month. All these changes that women experience each month are normal. It can vary, however, depending on how well hydrated we are, on whether we're taking any type of medications such as decongestants, which can dry out mucous membranes. It can be due to birth control methods, and changes can occur even due to our diets. For women in menopause, they will notice a significant decrease in their vaginal discharge due to the lack of estrogen that occurs. I'll talk more about this on upcoming videos regarding menopause. Now, vaginal discharge can be a sign of infection inside the vagina, the cervix, or even the uterus. Usually, this type of discharge, an infectious one, does not have the same characteristics as the discharge I just described to you. A vaginal infection can be due to bacteria or to yeast. These infections can occur often due to an overgrowth of the bacteria or yeast that are normally found inside the vagina. And unfortunately, all women, sometime during their lifetime, will probably get one of these infections. Anything that causes a disruption in the normal flora inside the vagina, like antibiotics, can cause these type of infections. They are usually easily treated with an antifungal or an antibiotic. But there are certain foreign bacteria that can enter the vagina. This can occur due to improper use of devices or vaginal products, or more commonly, sexual contact. Toxic shock syndrome is very rare, but can occur if tampons, menstrual cups, cervical caps, or diaphragms are left in too long. The bacteria introduced can produce toxins as well as poisons. This type of infection can be deadly for women. Most importantly, to avoid the risk of toxic shock syndrome is to change these products out regularly, at least every 4 to 8 hours. The more common foreign bacteria that can be entered into the vagina is through sexual contact. And these are the ones that can cause STIs, or sexually transmitted infections. These type of infections can be very harmful to a woman's body, leading to organ damage, scar tissue, and chronic pain and infertility. These infections can often be treated by antibiotics, but are potentially very serious and can be deadly for women. On a happy note, most vaginal discharge is totally normal. But if you have questions or concerns, please contact your healthcare provider so they can examine you and they can place you on an antibiotic or treat you with an antifungal if they need to. For more information, be sure to visit our website at 307midwife.com. Thanks for watching again, and have a great day.